Good evening. This is Marcos Breton, columnist with the Sacramento Bee. Welcome to our Facebook Live with Mayor Darrell Steinberg. Mayor Steinberg, it's great to see you.
Good to see you too, Marcos. How are you?
I'm doing well, Mayor. I'm doing well as one can be in a pandemic, I suppose. But let's talk about that, Mayor. There's a lot of news going on in town, but I think for the purposes of this discussion, I think it would be helpful for our readers, for our viewers to talk about the issue that we're all contending with, and that's our mental health. This is a topic that you've dedicated your life to, your career to, and I don't mind saying that today marks 2 months since I was last at the Sacramento Bee newsroom. 2 months ago today was the last day that my children went to school. It was the last day I went to the gym. It was the last day that I had lunch at one of our beautiful Sacramento restaurants with another person. And I miss all those things terribly. And I have personally gone through moments of despair in the last 2 months. And I'm not ashamed to say that. I'm a very positive person and a very confident person, but being cut off from colleagues and friends and worrying about my situation at my place of work and the livelihoods of friends has really seemed like a weight. Can you tell our viewers, first of all, let's begin very simply, can you relate to people? You've been very positive as the mayor, but in your private moments, can you talk about how this pandemic has affected you and your mental health?
Oh my God. I'm so glad, first of all, that you raised this subject that we are so often and too often unwilling to talk about. And, I have dedicated a lot of my professional life to improving the so-called mental health system in California, because I think it's the unaddressed issue of our time. It's the root of so many of our problems, and yet we shove it aside because we're afraid to talk about it. And change starts with acknowledging that we all deal with mental health issues. And so for me, yes, I'm a positive person like you. And yes, I have an important job to try to uplift people and to make sure that people are feeling hopeful in a difficult time. But let me tell your viewers, and I've said it before on a couple of other of my Facebook broadcasts, you better believe I have had moments of despair. I've had moments where I felt very depressed and where I've been anxious. I will tell you, I feel in the last 2 weeks that I have gotten what I call my mojo back, where I feel like, all right, I am myself again. I think those first several weeks, and there was sort of an in-between time, I was having trouble concentrating. I was having trouble, focusing, I guess, which is the same as concentrating. I love to write. I could not sit down and write a sentence. I felt like I was getting through my day and getting through my official duties, but in sort of an out-of-body experience. And I think it's because I felt the same dislocation, the same awkwardness about being stuck in my den. It's a nice den, but being stuck in my den and doing the job that I love, where usually I'm among the people in such a remote way. And so if you are out there and you have not had some moments of despair or haven't felt some depression or wondering what the meaning of life is amidst all of this, then frankly, I don't think you get it. And I don't believe many people have avoided that experience. And part of making the mental health system better is normalizing mental health. Because we are all human beings. We all have our moments. And then there are people who suffer from more serious mental illnesses, but their illness is no different than somebody who suffers from diabetes or some other physical health condition. They just have what they have. And so we have to talk about it. And when we talk about it, we then get more comfortable with addressing it as the priority in our public policy and our budget decision that it has to be. And so, yes, this is a difficult time. And if the coronavirus is the pandemic, I worry that mental illness is the next epidemic. You know, the calls to suicide hotlines, one prominent suicide hotline in Los Angeles went from 21 calls in February to 1,800 calls in the month of March. The statewide mental health warm line saw a 96% increase in calls during this last several weeks and months. And so people are feeling it, and we need to support each other, and we need to make sure that nobody feels disconnected from another human being.
So if someone is watching us right now and they are in despair or they are feeling hopeless, what should they do?
Well, first of all, they should not be afraid to talk about it with somebody they trust, because sometimes we keep our most painful feelings to ourselves, even among the ones we love. Now, there are some situations where people are in abusive relationships or in, problematic relationships where that wouldn't be helpful. But in most instances, if you live within a family unit where your child or your spouse or your parent knows that you are there to hear them and they're here to hear you, reach out to somebody that you love, and don't be afraid. Do the same with a friend. But if you can't do that, there are all kinds of resources in the community. We have posted consistently on our engagesac.org website and all of our social media the various hotlines that you can call to get help. Suicide prevention is one, but there's a youth crisis mental health line in Sacramento. The National Association for the Mentally Ill has California and Sacramento chapters. You can reach out for help. There are a wide variety of numbers you can call, websites you can access, and get in touch with a live person who can refer you to help. You know, my colleague Jay Chenier has been working on a youth mental health initiative, and we were talking earlier, and he told me they just finished a study that said 65% of Sacramento's young people, mostly teenagers, do not know where to turn if they're feeling depressed or anxious. And so part of what we want to do, and maybe even with these new federal stimulus funds that we have, is we want to do a massive public education campaign, not just for young people, but for all Sacramentans, to make sure they know that there is a place to turn before they get desperate. It's true that the system is underfunded. There isn't enough help for people in many different ways, but you can always connect with someone you know, someone you love, a stranger. There's help out there.
So, who I was thinking of today are the kids who would be graduating from high school. And this would be the time where they would be walking down the aisle. And I even get a little emotional just thinking about it. Because I remember when I did. So what can we say to those kids? What they've worked for all these years, and they were at least for the time being denied that opportunity, that lifelong memory, because we're all sheltered in place.
Well, I mean, of course, the easy answer, but it's the incomplete answer, is to say, well, we should say congratulations to them and we're sorry for what you're going through. But I think we have to go deeper than that. I think we have to acknowledge and talk openly about the loss that they are feeling, that they do not get to celebrate appropriately a very important rite of passage in life. And there are losses now occurring in profound ways everywhere. I mean, think about the people who lose a loved one who cannot have a proper funeral service for their loved one. Think about the joyous occasions, the weddings that have been postponed, or the babies born where the grandparents cannot, pay that first visit and greet their new grandchild. But for young people who have worked so hard and deserve that special recognition that comes with graduation, I think we have to not only say congratulations, we love you and we honor you, but also acknowledge that this is really hard, and then plan affirmatively to have the right kind of celebration for them sometime in the future, whether it is their first winter break from whatever they are doing, hopefully college in their freshman year, but to make it clear that we are going to all find a way collectively to celebrate in person whenever we can. But to also say to all those young people, recognize also how lucky you are, that there are a lot of people in the country and in the world that really have it hard, that and I'm sure some of the parents of some of the kids graduating have it hard too. People who have lost jobs, people who don't know whether they're going to be able to pay the rent for their next month and don't know where they're going to live, or if they might end up on the streets. And I think it's always important to have perspective and to have gratitude for what you do have. And we all do have a lot, even if we are missing some of the important things in life. But I'll tell you, the one thing is that no matter what we miss in terms of our rituals and our celebrations, the fact that we have life and we can look towards the future means that there is always a way to make it better. There's always a way to come back. And I think we always have to keep our eye on those point in times in the future when we can make up for what we lost.
So, Mayor, I really appreciate your answer because I do feel like, particularly with young people, with teenagers, 2 months can seem much longer than it would to you or I. And without the benefit of a lifetime of experiences, positive and negative, that perspective that what they're going through is a moment in time can be elusive. And the fear that I have, and I think the fear that a lot of parents have, is that the child will withdraw within himself or herself and contemplate hurting himself or contemplate something worse. So if you're a parent and you have a child who's experiencing or verbalizing despair, and it manifesting itself in words that speak to wanting to hurt himself or herself or do worse than that, what should a parent do?
First of all, a parent who hears that or who senses that intuitively must take those words seriously, because it is never okay to say, well, it was just a moment. I'm sure they don't mean it. Take the words and even the action seriously, and reach out aggressively to make sure that your teenager can talk to a professional immediately. Threats of suicide are to be taken seriously. The teen suicide rate is far too high. There are too many tragedies where parents blame themselves, and they could never blame themselves, but where they look back and they say, now I see or hear maybe what the child was trying to tell them, and I didn't think it was serious, because who wants to think that something like that is serious? Take it seriously and make sure that you use that moment to intervene and to get help for your child, either through your insurance, if you have it, and your medical provider, or again, reach out to one of those publicly accessible warm lines, hotlines, even suicide prevention, and don't let it go.
So, Mayor, staying on the subject of mental health, I have an observation that will lead to a question. So,
Yes.
so we've been in this for 2 months, okay? And even those of us like myself who are still blessed to have employment and a regular paycheck, live in a nice house, we're all anxious. We're all frustrated. We want our lives back. And there is a tremendous amount of pressure building in the state of California. And it's manifested itself from protests on the Capitol steps to politicians in some counties calling out the governor. So that pressure exists here in Sacramento County as well. And there are steps that are being taken to open up our economy that's hurting so badly. Understood that. It makes sense. However, our testing is still not what it should be. Our antibody testing is still not what it should be. There's still no vaccine. And there is ample evidence throughout the nation and the world of what has happened when we open up too fast. So, giving complete respect to the pain that my friends and business leaders in Sacramento are experiencing, are we not, in our anguish and in our frustration, are we not hurtling forward too quickly, despite the political rhetoric? Are we not taking the chance that even though our hospital systems are not overwhelmed now, they will be in 3 weeks to 6 weeks?
Well, this is the dilemma that we face as a society, and certainly those of us in positions of responsibility who have either direct authority or input have to weigh very, very carefully. But I would say this, that we talked a lot about mental health over the last few minutes. And this might seem inconsistent with what we just talked about, but I don't think that it is. If it is a choice between our continued inconvenience and our frustration about not being able to live the lives we want to live, and the public health, given the risk of going too fast and infection spiking and more people getting sick and dying, I'm sorry, the balance has to fall on the side of public health, and we have to find ways through seeking support and help and lifting each other up to tolerate the inconvenience. That's one question, but there's a very different question that I think is even more poignant for me. And that is the balance between maintaining the public health and call it the public health and the economic damage being created by so many people out of work and so many businesses either shutting down or being at great risk of shutting down. Because on that balance, you have a tremendous consequence on that economic side of the ledger that also can lead to public health consequences, including desperation and a mental health crisis, suicide, all the things that can come with people losing hope. And so we have a failure of national leadership. I know I'm a politician who comes from one side of the aisle. I've always thought of myself and acted in a fair way, and always tried to be a nonpartisan when it comes to governing. But this has been a failure. It's a failure because when you look at other chapters of American history, where this country was at either literal war or figurative war, it is the President of the United States who has led the nation through. It was President Roosevelt who commandeered the manufacturing industry in this country to ensure that we had enough arms to defeat the Axis powers. And here we have a president who has largely delegated this to the state. And it isn't that we've given up on testing. It's just that we've recognized that there was not going to be testing to scale so that we can make much more scientific choices. Governor Newsom's criteria now for opening does not say that you have to have across the board testing. It just says you have to have enough testing to be able to be assured that you get a pretty good sample size of what's going on within your county. And so he also has said that you can't reopen restaurants, for example, unless you've had no deaths in the last 2 weeks. What is he really saying? I tried to translate this last week for my viewers. What he's saying is, let's start with the smaller counties here who have low rates, and let's see if opening up more broadly will lead to a big spike in hospitalizations and deaths. If it doesn't, then you take the next step in the controlled experiment and you do the same for urban counties. And you test, not just COVID test, you look every several days and every week whether or not you have that spike. If you haven't, you go another step forward. If you do, you either stop or you go a couple of steps backwards. That is, you call our new normal, that's our reality. This is going to be a series of controlled experiments because of the lack of testing the scale, where we recognize that imperfect balance, that the status quo is not sustainable because people have to work and businesses have to open, and we do the very best we can to try to maintain the low rate of infection, the low rate of hospitalization, at the same time move forward.
But Sacramento County is asking for, I don't know if exemption is the right word, but a reconsideration of the no deaths in 2 weeks rule, given the low level of hospitalizations that we've had, and the feeling from the county health office that the issue is being managed. Are you in favor of the state massaging that no deaths in 2 weeks rule for counties the size of Sacramento? And do you think that's a good idea?
I am in favor of it, so long as our public health experts, Dr. Galley and his team at the state, and Dr. Bielenson and his team at the county, believe that that we can do so, monitor it in the right way, and pull back if we have to, if we begin to see the spike that we have not yet seen. I think that I am in favor of moving forward so long as it is controlled and so long as it is based on the advice of the public health experts, because, you know, there's an interesting dichotomy here, Marcos, that the public, I'm elected, the county board of supervisors are elected, the public health officers are not elected. And yet they have the expertise that I don't have, that we don't have, to tell us whether or not that balance that we just spoke about and moving forward in the way we just spoke about is reasonable. So I view my job not as just taking what they say at face value. I talk to Dr. Bielenson every day. I talk to the state officials very often. But to question, to probe, to ask, and to then either be comfortable with their advice or recommendations or not. Thus far, I have been, because I think we have shown in the way that we have done this that we can achieve the right result. But if the question is, given the lack of of testing the scale, whether or not we can eliminate all risk, and whether or not if we open up more people may get sick, I don't think we can confidently say, well, the ants, don't worry about that. Of course, that's not what's going to happen. These are controlled experiments, but it's not to deal with your and my inconvenience. It is to recognize that that we have to open up the economy again because there's too much damage to life happening on that side as well.
You know what I noticed, particularly last weekend when it was warm, is people I know or know on social media dropping their guards a bit, having I noticed more than one person I know on social media over the weekend photographing themselves at a dinner table with other people who were not their family, nobody wearing masks, nobody socially distancing. There were people going to the river. They should not be doing that, correct?
They should not be doing that. And it really upsets me, just like the protests upset me, because here's the trade-off. Think about this. If we act frivolously when it comes to that which is more convenient for us, I want to go out to dinner. I want to go to a friend's house and have dinner. I want to see my friends.
Yeah.
If I choose to do that, I am then more likely making it difficult for somebody who's unemployed or underemployed to go back to work. What is that connection? The connection is that if we don't take every precaution when it comes to our convenience, wearing masks, not gathering in large settings, not having dinner parties, not photographing ourselves with pride that we're doing something that violates the rule. If we don't maintain the spirit and the letter of what it means to keep physically distanced, then it is going to be harder for those public health orders to be more aggressive, allowing more businesses to open and more people to go back to work. In other words, if a spike occurs because a group of people got together, as has happened at large church, it's happened, we read it throughout the country, because of just frivolous behavior around the convenience issue, not the necessity issue, then you're harming people who by necessity need to get back to their lives sooner rather than later. So I find that kind of stuff irresponsible. You know, nobody wants to be a scold, but, you know, you asked the question. I don't think it's right because it's a selfish act to put your own comfort and convenience above the need for somebody else to actually get back to what is essential to their lives.
What was worrying for me about seeing those things, and also conversations that I've had with people I know, these are people who, well, let me say this. So this issue, as all issues, become politicized. And so there's a political divide. Some people are positing this as people getting together as a expression of our personal freedoms, whatever. I know people who do not subscribe to that. However, they're small business owners and they're really up against it. They're trapped at home with their little tiny kids, and they're feeling that anxiety, that their mental health is being tested, and it's manifesting itself in looking upon safety measures with anger and frustration, and coming pretty close to disobeying them. And what I'm leading to, and my question is, say we continue to open things up. You're already contemplating outdoor restaurants and all those things. And listen, I'm a restaurant guy. I miss my restaurant so badly. But if we see a spike, are we going to be able to, if we tell people to go back home, will they listen? Or will they say, I've had it. I'm not going to do this anymore? And how concerned are you about that?
I'm very concerned about that, but I want us to do this in such a way that once we go forward, we never have to go backward again. And that relates to how we behave and how we go about reopening. I'll tell you, I have a lot more empathy for the small business owner that is at wit's end and thinks in the way you just described a moment ago, because that's someone I don't want them to go back or reopen against the rules. But at least they are dealing with a situation of necessity. But that's different from, those of us with first world problems, as I like to say, who, are upset because of the limitation on our freedom and therefore decide to go out and just defy the order as a political statement. What are you talking about here? This is a health issue. This is a public health issue. This virus is real. And, it could affect you and your family and your loved one as much as it could affect anybody else. And so I think everything that you've asked over the last few minutes actually ties together. That small business owner, that working person who cannot take another 2 weeks of this, the best chance we have to get them back to work is to not only work collaboratively with our county and our state, but more importantly, for the rest of us who have jobs, who are doing okay, to not just follow the rules, but follow them to the letter. And I think people should be wearing masks out there. I've said this consistently over the last couple of weeks. Is that some great inconvenience? If wearing a mask could prevent, and the studies show that it actually has an impact, could prevent another spike across the state and the country and in our community of this virus. Let's help the people who need help the most by doing what's within our control. Do our best to make sure that even if we don't know that small business owner, that we're thinking of her, and that she's got a chance to get back to work sooner because we didn't make the situation worse.
Well, Mayor, I could talk to you about this all evening, but we have reached the end of our time. On behalf of the Bee and all of our readers, I want to thank you for your time, and I look forward to doing this with you again. Thank you very much.
It's a great discussion. Thank you, Marcos, for all.
Thank you. My pleasure. And to all of you who tuned in, we thank you as well. We thank you for reading, subscribing, and we look forward to our next discussion. This is Marcos Breton, columnist with the Sacramento Bee. Thank you for joining us with our Facebook Live discussion with Mayor Darrell Steinberg. Have a great evening.
Good night.